In today's video, I will talk about tinnitus, which is not a disease in itself but a symptom caused by an underlying local or systemic abnormality. Tinnitus is the perception of sound like ringing, buzzing, hissing or clicking in the ears or head without any external source. It can be temporary or chronic and has many possible causes. In the upcoming slides, the most common and significant causes of tinnitus are mentioned. Hearing loss. One of the most frequent causes of tinnitus is damage to the tiny hair cells in the cochlea, a part of the inner ear. When these hair cells are injured, they can send random electrical signals to the brain which are interpreted as sound. Age-related hearing loss, known as presbyocusis, is caused by gradual loss of hearing as people age. Noise-induced hearing loss occurs due to exposure to loud noises. Noise due to concerts, machinery or using headphones at high volume may damage hair cells. Ear blockage. Anything that blocks the normal passage of sound into the ear can trigger tinnitus. These include ear wax buildup or cerumen impaction. Excess wax pressing against the eardrum may cause tinnitus. Middle ear infections called otitis media. In this condition, fluid accumulation and inflammation may be the cause of tinnitus. Foreign bodies like small objects or insects lodged in the ear canal may produce abnormal sounds. Medications or ototoxic drugs. Certain drugs can damage the inner ear, especially when used in high doses. Some of these are aspirin, non-steroidal anti-inflammatory drugs, certain antibiotics, for example gentamicin or erythromycin, diuretics, for example furosemide, chemotherapy drugs, for example cisplatin. The effect may be temporary or permanent depending on the medication and dose. Vascular disorders. Sometimes tinnitus is pulsatile. It beats with your heartbeat due to changes in blood flow near the ear. Common vascular disorders which may cause tinnitus include high blood pressure, atherosclerosis, turbulent blood flow in neck arteries or veins, arteriovenous malformations near the ear. Temporomandibular joint disorders. The temporomandibular joint is located in front of the ear. Problems with this joint, for example arthritis, jaw misalignment, teeth grinding, can also lead to tinnitus. Neurologic and brain conditions. Certain nervous system disorders may cause or worsen tinnitus. These include acoustic neuroma, which is a benign tumor on the auditory nerve, multiple sclerosis, a medical condition in which demyelination of hearing pathways occur. Head injuries or concussions causing traumatic damage to auditory processing centers. Infections and inflammation, inner ear infections or labyrinthitis, meningitis affecting auditory pathways, and otitis media. Other contributing factors. Stress and anxiety can heighten awareness of tinnitus. Excessive caffeine or alcohol sometimes worsen symptoms. Eustachian tube dysfunction caused by pressure imbalance in the middle ear. Meniere's disease, which is a disorder causing vertigo, hearing loss and tinnitus. A video on this disease will be uploaded next. So the key takeaway is tinnitus is a symptom, not a disease itself. It results from many potential causes. These include hearing loss, ear blockage or infection, medications, circulation issues, temporomandibular joint dysfunction and neurologic problems. Thanks for watching. Stay curious and keep learning. Follow us for more high-yield medical videos.